Hi, I'm Aljino Gabang, and this is Toxoplasmosis. Parasites that turn victims into mindless zombie-like creatures are fairly common in nature. Toxoplasma gondii is one such parasite. This single-celled parasite causes a disease known as toxoplasmosis. About a third of the human population is currently infected and remain unaware. This is due to the lack of symptoms of the infection, as a healthy person's immune system usually keeps the parasite from causing illness. However, pregnant women and immunocompromised individuals should remain cautious. A toxoplasma infection for them could cause serious health problems. Study shows that the infected generally exhibit shifts in personality and behavior, with occurrences of mental instability and changes in the body and neural chemistry. And here's Ivy De Jesus for the history of toxoplasmosis. Ivy?
Thank you, Aljan. So here's the history of toxoplasmosis. The protozoan was first discovered by Nicole and Mancox, who in 1908 isolated it from the African rodent Ptenodactylus gondii. Then in 1909, differentiated the disease from Leishmania and named it Toxoplasma gondii. The first recorded congenital case was not until 1923, and the first adult case was not until 1940. In 1948, a serological dye test was created by Savin and Feldman, which is now the standard basis for diagnostic tests. Toxoplasma gondii became recognized as a severe and potentially fatal disease of adults in 1968. After several cases of Toxoplasma encephalitis were found in patients with hematologic cancers, it then became more widely recorded as a cause of morbidity in immunodeficient patients, including AIDS patients beginning in 1983. So here's Franz Cardenas for further information about Toxoplasma gondii. Franz?
General characteristics of Toxoplasma gondii. The Toxoplasma trophozoite measures 4 to 8 nanometers in length and 2 to 3 nanometers in width. It is crescent-shaped and with a pointed anterior and rounded posterior end. Organelles like rhabdoids and myconiums associated with cell penetration are found in short conid on the anterior end. A spherical nucleus is found in the posterior end. In the infected microphage, the parasite in the porocytoporous vacuole is able to prevent lysosome, which otherwise would lead to the parasite being killed by the lysosomes. Pseudocytes containing proliferating tachyzoids are seen in tissue sections taken from patients suffering from acute infection. These do not have well-formed walls unlike during chronic infections. Cysts are found in the muscles in the central nervous system. The oocyst is ovoidal in shape, has a thin wall and measures 10 to 13 nanometers by 9 to 11 nanometers. And here is Rich Espino.
So how does the parasite Toxoplasma gondii spread to humans? First, the only known definitive hosts for Toxoplasma gondii are members of family Felidae, including domestic cats and their relatives. Unsporulated oocysts are shed in the cat species. Although oocysts are usually only shed for 1 to 2 weeks, large numbers may be shed. Oocysts take 1 to 5 days to sporulate in the environment and become infective. Intermediate hosts in nature, including birds and rodents, become infected after ingesting soil, water, or plant material contaminated with oocysts. Oocysts transform into tachyzoids shortly after ingestion. These tachyzoids localize in neural and muscle tissue and develop into tissue cyst bradyzoid. Cats become infected after consuming intermediate hosts harboring tissue cysts. Cats may also become infected directly by ingestion of sporulated oocysts. Animals bred for human consumption and wild game may also become infected with tissue cysts after ingestion of sporulated oocysts in the environment. Humans can become infected by any of the several routes: eating undercooked meat of animals harboring tissue cysts, consuming food or water contaminated with cat feces, or by contaminated environmental samples, such as fecal contaminated soil or changing the litter box of a pet cat. Blood transfusion or organ transplantation. Transplacentally from mother to fetus. In the human host, the parasites form tissue cysts, most commonly in skeletal muscle, myocardium, brain, and eyes. These cysts may remain throughout the life of the host. Diagnosis is usually achieved by serology, although tissue cysts may be observed in stained biopsy specimens. Diagnosis of congenital infections can be achieved by detecting Toxoplasma gondii DNA in amniotic fluid using molecular methods such as PCR.
So how do you know if you have toxoplasmosis? What are the signs and symptoms of toxoplasmosis? Symptoms usually occur about 1 to 2 weeks after you come in contact with the parasite. There may even be no symptoms. Signs and symptoms of ocular toxoplasmosis can include reduced vision, blurred vision, pain, often with bright light, redness of the eye, and sometimes tearing. Symptoms in persons with otherwise healthy immune systems include enlarged lymph nodes in the head and neck, headache, fever, mild illness similar to mononucleosis, muscle pain, and sore throat. While symptoms in people with a weakened immune system include confusion, fever, headache, blurred vision due to inflammation of the retina, seizures, and most infants who are infected while still in the womb have no symptoms at birth, but they may develop symptoms later in life. What can happen to an individual with toxoplasmosis? The complications listed for toxoplasmosis are as follows. For complications of a pregnant woman becoming newly infected with toxoplasmosis, we have spontaneous abortion in affected pregnant women and stillbirth. For fetal or newborn complications of a pregnant woman with toxoplasmosis, we have neonatal jaundice, newborn brain disorders, newborn eye disorders, and congenital toxoplasmosis, which is passed to the newborn through the infected mother by cross-placental contagion. Most non-newborn complications can only occur in the immunocompromised. Toxoplasmosis can cause complications in numerous body organs for immunodeficient people, such as ocular toxoplasmosis, which is the infection of the eyes, brain complications, brain damage, eye complications, eye damage, muscle complications, heart muscle complications, liver complications, lung complications, meningoencephalitis, toxoplasmic chorioenteritis, and retinochoroiditis.
What are the treatment for toxoplasmosis? Most healthy people recover from toxoplasmosis without treatment. Persons who are ill can be treated with a combination of drugs such as pyrimethamine and sulfadiazine plus folinic acid. For pregnant women, newborns, and infants, it can be treated although parasites is not eliminated completely. The parasites can remain within tissue cells in a less active phase. Their location makes it difficult for the medication to completely eliminate them. Persons with ocular toxoplasmosis are sometimes prescribed medicine to treat active disease by their ophthalmologist. Whether or not medication is recommended depends on the size of the eye lesion, the location, and the characteristics of the lesion. Acute, active versus chronic or non-progressive. Persons with compromised immune systems need to be treated until they have improvement in their conditions. For AIDS patients, continuation of medication for the rest of their lives may be necessary or for as long as they are immunosuppressed.
Prevention of toxoplasmosis. There are several general sanitation of food safety steps you can take to reduce your chances of becoming infected with Toxoplasma gondii. Cook food to safe temperatures. A food thermometer should be used to measure the internal temperature of cooked meat. Do not sample meat until it is cooked. USDA recommends the following for meat preparation. For whole cuts of meat, excluding poultry, cook to at least 145 degrees Fahrenheit or 63 degrees Celsius as measured with the food thermometer placed in the thickest part of the meat. Then allow the meat to rest for 3 minutes before carving or consuming. For ground meat, excluding poultry, cook to at least 160 degrees Fahrenheit or 71 degrees Celsius. Ground meats do not require a rest time. For all poultry, whole cuts and ground, cook to at least 165 degrees Fahrenheit or 74 degrees Celsius. And for whole poultry, allow the meat to rest for 3 minutes before carving or consuming.
For further prevention of toxoplasmosis, freeze meat for several days at sub-zero temperature before cooking to greatly reduce chances of infection. Peel or wash fruits and vegetables thoroughly before eating. Do not eat raw or undercooked oysters, mussels, or clams. These may be contaminated with toxoplasma that has washed into seawater. It is unadvisable to drink unpasteurized milk. Wash cutting boards, dishes, counters, utensils, and hands with hot soapy water after contact with raw meat, poultry, seafood, or unwashed fruits or vegetables. Wear gloves when gardening and during any contact with soil or sand because it might be contaminated with cat feces that contain toxoplasma. Wash hands with soap and warm water after gardening or contact with soil or sand. Teach children the importance of washing hands to prevent infection.
Now you may be asking, if I am at risk, can I keep my cat? The answer is yes. You may keep your cat if you are a person at risk for an infection. However, there are several safety precautions to avoid being exposed to the parasite Toxoplasma gondii. Ensure the cat litter box is changed daily. The Toxoplasma parasite does not become infectious until 1 to 5 days after it is shed in a cat's feces. If you are pregnant or immunocompromised, avoid changing cat litter if possible. If no one else can perform the task, wear protective equipment such as gloves and wash your hands afterwards. Avoid adopting or accepting stray cats into your home, especially if you are pregnant. Feed cats only canned or dried commercial food or well-cooked table food, not raw or undercooked meat. Keep your outdoor sandboxes covered. So what if your cat is infected? Will it always be able to spread the infection? Yes, but cats only spread Toxoplasma in their feces for a few weeks following infection with the parasite. Like humans, cats rarely show symptoms, so most people do not know if their cat has been infected. The Toxoplasma shedding in the feces will go away on its own. Therefore, it does not help to have your cat or your cat's feces tested for Toxoplasma.